In the week after Memorial Day, the news for Oklahoma veterans has been a mixed bag. On the positive side, there have been major improvements at the federal VA hospital in Oklahoma City, which has come under heavy criticism in recent years. At the same time, shrinking budgets continue to raise concerns about whether aging veterans can get the care they need at Oklahoma's state-run veteran centers.
U.S. Senator Jim Inhofe held a news conference this week at the Oklahoma City Veterans Hospital to update the progress that's been made since the facility came under fire for several quality of care issues. In December of 2015, an article by USA Today prompted a federal investigation into reports of inadequate care and incorrect diagnoses of patients at the facility. That prompted Inhofe to co-sponsor the VA Accountability Act, which he says will make it easier to fire employees who aren't doing their job.
At the time, one of the problems with the VA was that the VA, if they find that somebody's not working well, it takes them so long to get through all the red tape to make a termination of an employee that's doing a lousy job.
Medical Director Wade Vlasich, who was appointed to take over the Oklahoma City VA healthcare system last year, says 10 people formerly in leadership positions at the VA hospital are no longer working there.
We've had some unfortunate quality of care issues in the past that have been corrected, and we've had some people that were doing things that were highly inappropriate, and we have terminated people that were doing highly inappropriate things, and we are holding them accountable.
Meanwhile, the federal investigation is continuing at the hospital, with the Inspector General performing audits every other week, and a report on the investigation is expected next month.
Unfortunately, as things are uncovered, we want them to do a thorough job and make sure that we correct it. And so we have asked the IG to be as thorough as possible, because I would rather clean everything up at once than have a reoccurring issue come down the line.
One of the criticisms of the VA hospital in the past was the long wait times for veterans to see a doctor. Vlasich says they're trying to address that by recruiting more staff.
We've brought on new providers in primary care. We've brought on new providers in medicine, hospitalists. I just signed one. We've got new psychiatrists that are coming on board. We have a list of 9 psychiatrists that we're bringing on board to the hospital, and we're working the recruitments right now. We've hired an orthopedic surgeon. We've got a podiatrist that is about to start.
Another area they're trying to address is accessibility to health care. Vlasich admits the VA system is overly complicated.
As of last week, I added what's called 9 nurse navigators. So we're recruiting 9 nurses who will help coordinate care between the primary care and specialty care, either in surgery or medical subspecialties, to help them navigate their appointments, their benefits, and care coordination between the two.
Veterans can also get help navigating the system from the Oklahoma Department of Veterans Affairs. ODVA Executive Director Miles Deering says collaboration between the U.S. Department of Veterans Affairs and his agency is as good as it's ever been.
The fact is that our missions are much the same, is we all want to take care of veterans. And in order to do that effectively, I think it's necessary to develop a attitude of cooperation, collaboration, so that we're talking the same language.
Still, Oklahoma's budget woes may be threatening the ODVA's mission of taking care of Oklahoma's elderly veterans. The agency's budget has shrunk dramatically in the past decade, from more than $40 million in fiscal year 2009 to just over $31 million in fiscal year 2017, and another cut coming in fiscal year 2018 to $30.8 million. Deering admits those cuts can't help but impact the operation of the state's 7 veterans centers.
The fact is that we have to be smarter about how we spend our money. We have to ensure that the things that are absolutely necessary that we have, and those things that are unnecessary is that we save for another time.
That's meant reducing services, removing critical care equipment, and shutting down labs at the centers.
We're not acute care. We are nursing homes, and we're licensed by the state of Oklahoma and partially funded by the state of Oklahoma and funded by the federal VA as nursing homes.
But Deering says even with the reductions, the centers are still a cut above most long-term care facilities.
For instance, we have physicians, we have pharmacies, we have physical therapy. We have a lot of things you won't find in those normal nursing homes. But if we don't take care of our business, and if we don't do things in a rational manner in terms of how we spend, then we can't afford to have all those things in addition to just regular nursing care.
And while staffing remains an issue, Deering says it is slowly improving.
We have no choice but to follow the state guidelines in staffing our veteran centers, so we cannot fall below minimum staffing levels. But across the board, we try to keep those staffing levels above the minimum.
Despite the budget cuts, one move that is going forward is a relocation of the ODVA offices at a cost of $3 million. Deering points out the building that now houses the ODVA was originally built in the 1930s.
They consider it uninhabitable, and so old buildings such as this require a lot of maintenance and require a lot of upkeep, and we're running out of room.
And Deering says the ODVA will not be paying renovation costs for the new building, but will pay for new furniture and will pay the rent once they move in.